Our group chose to discuss the issue of the continuously plummeting life expectancy rates of Indigenous people in Canada. As the initial news article states, the First Nations life expectancy plunged by 6 years in British Columbia, from 2017 to 2021, and by 7 years in Alberta, from 2015 to 2023. At the same time, non-Indigenous people on average live for 15 more years than Indigenous people.
We carefully examined this issue and found several factors that contribute to it. These factors are the following, in order of appearance in the video. Lack of resources for remote First Nations reservations, shortage of Indigenous healthcare workers, racism in healthcare, culturally safe treatment of addictions and mental health in Indigenous communities, insufficient mental health services, and stigma surrounding Indigenous people, and the impact of COVID-19 pandemic.
Geological location is a key determinant of health and life expectancy, and for many Indigenous people, where they live directly impacts their access to timely care. Almost half, 44.2% of First Nation people live on reserves, and 72.8% of Inuit individuals reside in Nunavut. These remote regions face chronic shortages of healthcare professionals and rely on fine services, which lead to longer wait times, prolonged diagnosis, disruptions of continued care, and thus a higher premature mortality rate. Survey data highlights the consequences. Although 70% of Inuit in Nunavut saw a medical specialist, only 23% have a regular doctor and 40% reported having unmet healthcare needs, mostly due to limited access to healthcare, time constraints, or travel requirements. A study conducted by Lavoie examines the correlation between geological location and poor health outcomes among First Nation populations in Manitoba. Results show that remote northern First Nation communities have higher premature mortality and lower hospitalization for preventable conditions, not due to better health, but because of limited access, delays early diagnosis and treatment.
It's well established at this point that Indigenous health workers develop more trust-based relationships with their Indigenous patients and provide more holistic care. The question we should be asking ourselves then is, what barriers contribute to burnout and the greater turnover of Indigenous people from the profession? A study by Burke-Berskin et al. From 2025 tries to answer this question by analyzing the experiences of 18 Indigenous health workers who shared some obstacles they face when attempting to provide their patients with culturally safer care. The main issue all Indigenous healthcare professionals face is racism from their coworkers and patients alike, with the most common form of it being constant racial looks and racial slurs. Another point of frustration shared by the study participants is the expectation that the Indigenous health workers would educate the other team members about the Indigenous ways of knowing and being, but at the same time, try not to be overly loud about it. Almost as if it's a formality. Indigenous health workers are labeled troublemakers when they try to directly address the issues of racism in the workplace. As one participant of the study puts it, quote, "How do you encourage people to trust the system that keeps biting you?" Lastly, a common complaint voiced by most study participants is the constant red tape they face when trying to incorporate Indigenous health practices into the Western healthcare system. For example, not all team leaders allow nurses to perform rituals and ceremonies with their patients, and those who do require permission first. A newspaper article titled "Indigenous Health Workers Lived with Racism," published in the Globe and Mail by Lex Perot from 2021, goes into detail about one horrific case of burnout and disrespect that an Indigenous healthcare worker had to face. The article describes the story of an Indigenous woman, Barbara Flamand, who personally knew Joyce Echequan and worked at the same hospital where Miss Echequan died. On the day of Miss Echequan's death, Miss Flamand was not allowed into the staff area, and once inside, the administrator would not tell her where to find Miss Echequan. Only after Joyce Echequan passed away, a doctor on duty thought that Miss Flamand could be useful and asked her multiple times to inform the family of the death. These events deeply traumatized Miss Flamand, and she resigned several months following the tragedy.
A significant amount of racism still influences the lived experiences of Indigenous peoples today. Within Canada, the effects are deeply embedded within systems that claim to be fair. Institutional racism continues to exist through Canada's political, economic, and social structures. While laws that were passed with discriminatory intent, such as the Indian Act prior to amendment and the residential school system, have been abolished, the colonial ideologies that created those systems continue to reside in institutions today. A study made by Polarinos and others further examined persistent racism within Canada's healthcare system. The study explains participants' encounters of being stereotyped, dismissed, and disrespected for their traditional medicine practices. In addition to this, they also have experienced deep mistrust towards medical facilities as a result of their experience with injustice. To be more specific, an unfortunate event that occurred in 2023 involves an Indigenous woman, Myra Cow Chief, who died after visiting a hospital. She had been discharged after hours of being invalidated, despite her severe abdominal pain, which indicated serious need for medical treatment. Her death was reportedly caused by internal bleeding, a result of negligence and discriminatory attitudes of healthcare professionals. There is no ethical or moral basis for sustaining racism. To achieve true reconciliation, we must emphasize the importance of creating culturally safe environments with Indigenous knowledge and tradition. Working towards being able to provide equitable access to quality healthcare for all Indigenous peoples directly prevents unnecessary deaths.
One of the strongest contributors to low life expectancy in Indigenous is the ongoing impact of mental health challenges and addictions. Many Indigenous individuals live with the effects of trauma, leading them to depend on alcohol and drugs. Yet they often face healthcare systems that neither understand nor respect their culture. Rowan and others discovered that Indigenous-led cultural treatments such as sweat lodges, the most common one, traditional herbs, and guidance from elders can play a powerful role in recovery. These programs help restore balance between the mind, body, emotion, and spirit. In their study, more than 70% of participants reduced or overcame substance use, which shows that culturally healing approaches are effective and improves overall wellness in addressing addiction and substance use problems. In addition, Wu and others presented integrated care programs using the two-eyed seeing approach, which blends the Indigenous and Western knowledge to create an even more culturally safe healthcare. These programs combine traditional healing with clinical methods which strengthens trust, participation, and recovery. However, tensions remain, such as limited power and recognition of Indigenous healers. The study also found that holistic care improves overall wellness when Indigenous knowledge guides the process. Finally, the NCCIH report by Justice Key concludes that improving mental health and addiction services for Indigenous people call for Indigenous-led, culturally centered, and equity-based approaches. Therefore, supporting self-determination, traditional healing, and fair funding, Canada can build a more accessible and culturally safe treatment care, helping Indigenous communities achieve healthier and longer lives.
COVID-19 exposed how existing inequalities left First Nations communities in Canada disproportionately vulnerable to the virus. An article by Thompson explains the disadvantages of the First Nations people had to face. In the article, the Public Health Agency of Canada states that those with pre-existing health conditions or weaker immune systems are more vulnerable to COVID-19 compared to others. Disease rates are higher for First Nations people than the rates for other Canadians. For example, diabetes rates are 17.2% for First Nations people living on reserves, 10.3% for those living off reserves, and 7.3% for Métis people, compared to only 5% for the general population. Additionally, hospitalization for asthma and respiratory tract infections are higher for First Nations people on reserves than other Canadians. This means that a disproportionate number of First Nations people already face serious health challenges, making them more vulnerable to COVID-19. When it comes to following the basic health advice to prevent the spread of disease, such as social distancing or washing hands, it is almost impossible for Indigenous communities. This is mainly due to many First Nations homes being overcrowded and having unsafe water systems. The article states that 37% of First Nations people on reserves live in overcrowded households. Water issues also make hygiene difficult, since 73% of water systems on reserves are at higher or medium risk of contamination, and many homes even go days without running water. According to an article by Statistics Canada by COP, First Nations people had the highest COVID-19 death rates in Canada, with mortality being 4.5 times higher than non-Indigenous people. COVID-19 death rates generally increased for elderly groups, but First Nations people 80 years and older had nearly double the mortality rate of non-Indigenous people.
Indigenous peoples in Canada face a severe and ongoing mental health crisis marked by inadequate and culturally unsafe care. Despite strong evidence showing for higher rates of mental illness, mainstream health systems continue to overlook Indigenous needs. A study by SMI explains that Indigenous mental health has often been glossed over by authorities, resulting in inequitable access of care. This neglect is deepened by differing worldviews. Indigenous people see health as holistic, uniting physical, mental, emotional, and spiritual wellness, while Western systems remain divided and biomedical in approach. Historical trauma from colonization, residential schools, and systemic discrimination continues to affect Indigenous well-being. Many experience chronic undertreatment of conditions like depression, anxiety, and PTSD, which affect quality of life and longevity. According to Statistics Canada, over 90,000 youth in Ontario aged 1 through 17 with mental health disorders had an unmet need for care, revealing deep systemic gaps. Furthermore, they may also turn to substance abuse to cope, but that leads to more issues down the line like addiction, and seeking help for this is stigmatized. Additionally, in BC, Indigenous youth and young adults face a suicide rate 4 times higher than the provincial average. Addressing these disparities requires trauma-informed, culturally grounded care that embraces Indigenous knowledge and promotes holistic healing.
It is evident that numerous interconnected factors have contributed to the disproportionately high premature mortality rates of Indigenous individuals.
High rates of addiction that can be traced back to Canada's colonial history, the same history that marginalized Indigenous communities onto remote reserves where health resources are scarce. This, coupled with modern-day stereotypes of Indigenous individuals within the healthcare system, the lack of Indigenous voices in healthcare policy and delivery, and the additional strains caused by COVID-19, has contributed to the lower life expectancy of Indigenous populations.